When you have pain because of active arthritis and inflammation, then that's inflammatory pain, where your immune system is revved up and bringing a lot of different immune system players to the site of the joint, and that can cause a lot of pain. And so that's inflammatory pain. And then there's nociceptive pain, the fancy word for that, meaning if you put your hand on a hot stove or you sit on a thumbtack. So those things that are meant to cause pain, they're supposed to be painful. And both nociceptive pain with heat and sharp objects, or this inflammatory pain, those are meant to be protective types of pain. So those are the types of pain that say, alert, alert, something's wrong. So you're supposed to have that pain, so that way you can care for your body. But then there's another type of pain that doesn't serve that same purpose, which is kind of considered a dysfunctional pain, or the term for that is a nociplastic pain, is the fancy word. And so nociplastic pain is where your nerves are sending pain signals and it's very real, but they're not supposed to be doing that. And your brain can start to interpret regular sensations, like even touch or pressure, as pain because the nerves are basically on a loop of pain. So those are basically the different types of pain. And so it's important to work with your rheumatologist to figure out which type of pain your child is experiencing, because you need to know if there's an ongoing underlying trigger like active arthritis. Because if there is, you need to treat that. And maybe once you treat that, then the pain will improve or mostly resolve. But if you treat it and there's not active arthritis, then there might be more of that dysfunctional or nociplastic pain, or we also call it amplified pain.